I can definitely see that there is significant change that is happening because of technology in general. Now, what is the impact of AI? I think AI is an accelerant. No, I look back when I came out of medical school and the impact of just Google, like the fact you had all information at your fingertips. That was actually a massive change for the health professions, right? Because the assumption had always been that, well, there was a massive power differential between a clinician and a patient. Very quickly, it changed to, like, the patients were coming in having Googled everything, and having that conversation and having an empowered conversation. Wasn't a negative thing. This was like, okay, well, I've looked this up, and this is like, look at this evidence, or I think this, or whatever. And they were having a very kind of, patients were having a much more, some patients, not all patients, but a significant number of patients were having a much more nuanced conversation with a clinician. And suddenly clinicians had to step up to that, right? They couldn't just say, well, I'm sorry, but I'm the surgeon, I've done this for 40 years. I don't care what your opinion is, this is how we're doing it. With AI, what I saw was an accelerant, much like the curve of uptake of, the most downloaded app in history. In like 6 months, it went to like 2 billion or whatever. Yeah. It literally was the same thing of how the scientific community kind of accepted this, right? Yeah. Was that what I saw? Was that actually very quickly, unlike it in the previous kind of iteration of this, of technological intervention, where it took a long period of time for people to kind of accept it and understand it and work with it. AI had that same kind of storming, norming, performing kind of phase where there was people who were just totally dismissive and angry and pissed off and, all of that stuff. But it very quickly shifted, very quickly, to be like, hold on, this is a game changer.